Hello, Namaste. I welcome you all to this 30th session of Gurubodha. We have with us Dr. M.B. Gururaja sir. So, to start off this week, on a sad note, basically, we lost one of the, 90s and 2000s was dominated by a famous Australian cricketer, Shane Warne. But unfortunately, we lost him at the very young age of 53. He had gotten COVID-19. It went up to the extent of being ventilated. So, a pretty serious kind of COVID-19. And this is okay. Timestamp is not there, but this is on February 28th. He said that he tweeted that Operation Shred has started 10 days in, and the goal by July is to get back to this shape from a few years ago. So he posted a picture of himself from a few years ago, and he wanted to like get back in shape. Probably he was in a rigorous exercise regime. If you had COVID, or even if you did not have COVID, it's not a good time to get into rigorous exercises. Guraja sir, your comments, sir, please.
See, definitely, post-COVID, there are a lot of issues related with the various systems getting involved, nerves getting involved, lungs and respiratory system is involved, even cardiac issues are there. So we should be very, very careful when the infection is already taken place, and there should not be any rigorous the previous the way we used to live, that type of thing you should not be done after onslaught of COVID onto this entire world. So we should be very careful in handling the health, basically because of various other unknown reasons. It is yet to explore why it is happening in that fashion. So the data is getting generated, but unfortunately we have lost a legendary person.
Just a few months before, we lost another exercise freak and famous Kannada legendary personality, Sri Puneet Rajkumarji. I would believe that now that we are 2 years into pandemic, probably we all had mild COVID, but we do not know if we did not test, or we really cannot be really sure that we did not had COVID. Most of us have had an occurrence of cold or fever during this period, and that could be COVID. So, I mean, everybody stayed at home, so everybody have put on a weight a little, but we should not be in a very hurry to shred that weight and to get back in shape. As Guru said, it should be probably a very gradual and methodical manner.
See, first of all, we need to understand that when we are not utilizing all the energy what we are supposed to utilize or usually used to do it earlier, when we are not doing because of the COVID and various other reasons, and we are being made to stay at the home. So when this type of things are happening, we should be very cautious, and it should be very, very careful in consumption of the food. We need to cut down on the calorie intake and the diet what we take it. So then only we can manage even without the exercises are going out whatever it is. Otherwise, it will be very difficult that you are already just having a habit of consuming a typical manner. You are eating in habits, and ultimately at the end of the 2 years you have put on 60 kgs or 10 kgs, something like that, from your original weight. Then definitely it is a burden on you as well as the system. Then if you try to remove it at this point of time in a rigorous manner, then all the high chances are there that you may end up in just harming the system. So you should be very, very careful in dealing with this.
Yeah, the probable cause or pathology that is happening here probably is that there could be some vascular damage in some part of the heart, or in other some part of vessel, and there's a plaque, and due to rigorous exercise, probably it's getting lodged into the coronary arteries and leading to a heart attack. So.
See, the reason is one of the thing is that it have understood already. We have reported many such cases where it has an effect on blood vessels as well as the blood tissues. But we need to understand one thing: when person was made to stay home for long, long time at the house without doing any exercises, just consuming, and he might have developed a lot of plaques and cholesterol and all these patterns. And suddenly, when he went out to remove it out in a rigorous manner, it might have just come out as a flake or even atherosclerotic things, which is very very common. So we should be very very cautious in handling these things. Slowly and steadily, we need to change or adapt the system. Otherwise, it will be very very difficult for everybody, those who are at least infected, or even at this stage of time, those who are above 50. So we need to be very cautious in that.
And like you said, cutting down on food intake in that way, restricting the calorie that is going in is a smarter strategy than burning the calorie out, at least at this point of time, like you
See,
said.
that's what they are doing even during COVID period when they are being made to sit at home. They happily ate whatever they got it and even increased their diet by watching TV or something like that, or some on laptop or some work or work from home, continuously consuming something. So which has already gone into dogs because they never realized that it will going to happen in this way. But now the things are happening in this way. At least we need to now understand that slowly we need to come out of this space. It is not the rigorous one. The slow and steady wins the race here.
And coming to Ayurveda references for exercise, in Ashtanga Hridaya Sutrasthana second chapter itself, they have clearly explained. Ayurveda has never been a fan of like excessive rigorous exercise and whatnot, like the bodybuilders and other people do. I have collected a few slokas from Ashtanga Hridaya, and along with this meaning, I request Guru sir to kindly explain the slokas. I'm just sharing the screen now. It is as per Ashtanga Hridaya second chapter. It says, Abda Shaktiya Nishayvyastu Balibihi Snigta Bhojibihi Shitakale Vasante cha Mandameva Tadonyata Tam Krutva Anusukam Deham Mardayet cha Samantataha. Guru sir, can you please elaborate on this, please?
See, very clear thing. There is a very strong individuals who can consume fat and all those things. Of course, this diet regularly practice exercises. But in winter and spring, we need to use a maximum strength because we will be having good strength then. But very clearly, it is said Vyayamo Ardha Shaktihi. So very clearly, it is said we need to do our exercises to half of one strength. So understanding this point of view that we are doing, but there are many people they are continuously sweating and still they are rigorously doing the things. That is going to cause a damage. Ayurveda very clearly said Vyayamo Ardha Shaktihi. So it should be according to one's Ardha Shakti has to do it. It may be in the some winter and spring season we may do it little bit extra, but in other seasons you should be very cautious, even lesser than that. And as soon as you start sweating, that is a clear indication that you are using half of your strength. Then that is a time to stop it. But people are continuously make the body to sweat like anything in gym and all those things, feeling that that is going to burn the calories. It may burn the calories, but it also burns your vital organs, and vital organs may get damaged.
And continuing the same, they clearly, in the very next sloka, Master Vagbata explains various side effects of excessive exercise, excessive thirst, emaciation, difficulty in breathing, bleeding disorders, exhaustion, cough, fever, vomiting, and whatnot. And then there is an interesting shloka that, Guru sir, can you please, I just, because you taught us Ashtanga Sangraha when we were in first year. So I just want to hear it from you, please.
So it's a very clear. If you indulge in excess vyayama, definitely it is going to cause a damage. See, we all know that Rajayakshma is one of the disease wherein it is very clearly mentioned that Adi Vyayama also leads to Rajayakshma. Similarly, the one who is doing this one, and if a lion tries to kill an elephant and drags it, even though it may have a strength, but by doing that, definitely it will going to just simply perish. It cannot, it will destroy itself because the strength of the lion can match in killing an elephant, but if it drags the elephant, then that may be leading to lot of troubles. So that's the reason they are very clearly said Vyayama and Ratri Jagarana and excessive walking and excessive sexual activities, Hasya, Bhashya, all these things also going to cause a lot of effect on the body. There should be limit for everything. That's what the Ayurveda has spoken very clearly. Everything should be in the limit. What the limit it should be. That's why very clearly they have mentioned for Vyayama, it is Ardha Shakti.
Yes, sir. And comparing yoga with gym and rigorous exercises, probably during these times when we are like recovering, getting back to our normal daily routine, probably yoga could be a starting point or a better choice.
Definitely, yoga would be better choice because it improves your flexibility, and it also periodical and rhythmic breathing pattern is also there. It doesn't allow your heart to excessively pump the blood and get accelerated. So it will slowly brings into action. So that is always good. It improves your flexibility as well as your reflexes that will be very easily expandable, and that can be done by using better options of yoga and pranayama.
And probably stress during these COVID times, like last couple of years, have been financially and family wise also very difficult for many of us. So that also, gives a lot of stress on the heart. And probably yoga and pranayama would be a good stress buster and it helps us to refocus and regroup our life in the right direction.
Definitely, you see, yoga very clearly. It's not simply one yoga of what you call simply putting asanas or pranayama. There are so many aspects related with that. Ashtanga yoga is there. Yama, niyama, and all these things are there. Then comes the asana and pranayama, all these things. So it will not only simply just doing any rigorously exercises or even vyayama or even yoga for long hours. No, it is not like that. There is a very clear prescribed manner how a yoga has to be done. How before that you need to get into all the aspects of Ashtanga yoga. Then only you can have the benefit of yoga. And now the yoga has also been recoined and reintroduced with various names, power yoga and so many things. That may not be good one. So that is entirely different. What the classical textual and things which has been Guru Mukhena learned and it is being practiced, that yoga is good to us.
Any ancient sciences better to treat with some amount of sanctity. Now we have like beer yoga and hot yoga and yoga specifically for sweating and all. I mean, if we just take the exercise part and leave out the other aspects of Ashtanga yoga, it would be a disaster even there.
Definitely, definitely. See, first of all, that there should be some sankalpa. In the mindset, there should be what I am going to do and how I am going to do, how much I am going to do. All these things are being pre-planned and designed. So that has to be done with the help of yama and niyama and all those things. How to control the things. Once it is under control, then in that controlled area, how you have to perform the vyayama, that is yoga and pranayama. That if that type of activity it is done, then it is definitely going to help us. Otherwise, they're simply doing some power yoga, super power yoga, some nonsense names have been floated, and people are fond of that because they always want to have some new names and new things, and they don't want to go for the old one, saying that old one is obsolete now. So we need to have something which is Yuganurupi. So that's why they want to have some name changes, but it becomes a same old wine in a new bottle.
And
Some alterations are there, and that alterations are not supported by the classical text, and that is going to cause damage.
the same thing is happening even with Ayurveda also, especially in the Western world. It needs a standard marketing angle. And I mean, if we are just talking about, say, Ashtanga Hridaya or Ashtanga Hridaya, Ashtanga Samhita and this Chara Samhita and all, there'll not be a marketing angle on that. But if I put my Hebbars Ayurveda and sell it, so similarly, like that, many other versions, variants of Ayurveda is coming up in the US. That my guru told it to me, so it is kind of unique, and they try to kind of repackage it, which can be really dangerous. And I keep on encouraging all Ayurveda students that don't get too much carried away with heroism and showing that it's their own unique knowledge. give the Shastras the respect first and then to the teacher.
See, very clearly, Ayurveda knowledge is not limited to somebody else, and it is in the public domain and anybody can utilize it. But credit should be given to the original text and original contributors of olden days, and they have, without any of their interest in that, they have given all these information which we are using now. So after taking those information from them and putting our names and coined it and saying that it is my own thing and I am the one who is the inventor and I am the one who has been practicing this and all those things, it becomes somewhat bogus. Only thing is that we need to stick on to the classical and basic things and read the classical text, understand its concepts and why acharyas have said that, and how we can utilize it, these concepts and principles in a given situation. That we need to understand and we need to learn that and it is utilized. That's the basic thing.
Talking about Ayurveda in the Western world, recently, just in the last week itself, one of the big celebrity in the US underwent Aaron Rodgers underwent Panchakarma cleanse, and this has been highlighted by many of the mainstream media in the US. What is Panchakarma? And Aaron Rodgers said he did like 12 days cleanse and all. In the entirety of the US, I have asked this question to many Ayurveda students from US, and all of them agree that total number of population in the US who have heard the term Ayurveda, not experience in treatment or taking a supplement and all, just who have heard the term Ayurveda is just 1 to 1.5% only out of 33 crore. 1 to 1.5% of US people have heard the term Ayurveda at this point. So I do a lot of research on like how a thing can go viral, how a video goes viral, or how a subject goes viral, or it is adopted by a large group of population. And celebrity endorsement, hands down, is one of the ways in which it spreads very rapidly. Of course, there are many like Ayurveda warriors, I would say, who are bravely practicing Ayurveda, even though many people do not know much about Ayurveda, and they are the torch bearers. But this kind of event really pushes Ayurveda ahead, sir.
Definitely, the Western world, which is not so exposed to the Ayurveda and its principles, the treatment and its benefits. Definitely, when a person from the West with a popularity or a celebrity like person endorses Ayurveda or Panchakarma in the name of cleanse or detox or whatever it is, because they are familiar with that. And definitely it will going to push the Ayurveda into a different levels. Let it be when somebody see in a few years back, even Akshay Kumar has endorsed that how is the Panchakarma going to help and how he has taken Panchakarma treatment at Kerala and how he was feeling like that. So these are very common to push the things. And it is a good. If a celebrity endorses it, it is good.
Even mainstream media, the CNN, other news portals have taken it and have portrayed a bright picture of Ayurveda. At the same time, there is now a WebMD article saying that Aaron Rodgers Panchakarma's cleanse is kind of a dangerous play and we should be careful. It's detoxifying, it affects kidneys, digestive system and liver, vomiting, enema, nasal drops, many things are given. At least they are getting to know what Panchakarma is, they're getting a rough idea, but they are already making decisions on side effects of it. Just the propaganda of it sometimes is difficult to digest, sir.
See, it's very clear. There are market leaders, the Western medicine, and they are the mainstream. They are the market leaders in healthcare. And suddenly, if somebody comes with a new idea and some celebrity endorses it, then definitely they'll feel the fear of that losing the customers. So that's why how to protect the interest of their supremacy is by showing the wrong side of the Ayurveda. See, this is a problem with Ayurveda, and if you go, then there may be danger and this, all this. So when they say like this, definitely some people may listen to them. So that's the reason they are quoting this. But slowly and steadily, people are realizing that what Ayurveda can deliver And once they are experienced, then definitely they will stick on to that, and they won't listen to these type of mall propagandas what they're doing it. So many a times, even sometimes our acharya used to tell to us, our gurus, even a bad propaganda is also a right kind of propaganda for us. By the name of that bad propaganda, at least they are trying to highlight us into the different levels of the media, and people will be talking about us. Let it be. And when an opportunity comes to us, then we will show what we can do it, and how we can handle the conditions, and how they are better placed than the other sciences. So that is the reason they are very much, even they are such type of propaganda, even for the ST Madhu also they are quoted it's going to cause cancer and something like that. So many such things are there. But still, people are very clever. They observe everything, and they'll observe that even the media and everybody, how their what is their interest, everything they'll learn, and they'll only realize it when some of them close related person, somebody takes these type of disease, cleanse and all those things, panchakarma therapies. When they are feeling that they are benefited, then automatically these things, the wrong propaganda or the bad propaganda will no more stand in the public.
And also, there is a section of like Ayurveda community people who are like hardcore traditional ones. They do not like Ayurveda going like mainstream and all. They feel that Ayurveda will eventually get diluted and somebody will make money out of it and it becomes all commercial and all. And I personally feel that that's not the right way to think about it. More people adopt Ayurveda principles, maybe in the form of a supplement or treatment or therapy or just changing their lifestyle. There are so many aspects of it. Cosmetology is there, health and mind related adjustments as per Ayurveda. So, like you told, any kind of publicity is good publicity. And we, being very small players in Ayurveda, Ayurveda is huge, and Ayurveda, I mean, was there previously before we came, and it will be there forever, even after we go. So we are not kind of the entire stakeholders of Ayurveda. We are just a part of it. So let it grow to the world and let everybody be benefited out of it, sir.
Definitely. See, there is no meaning that somebody will take away and they'll rename it and they rechange it or something like that. They're making money. Why you are concerned about that? What is your concern? Your concern is only about your Ayurveda and the Shastrokta. You just do it. Let the other person also do whatever he can do it. But at the end of the day, at the end of the time, the thing one which will going to sustain is the one which has real credibility, that will stay back. So definitely we should not feel that there is not a right kind of thing. Let it go in a way it has spreads. See, when it spreads bigger, it becomes a viral. You can't hold it or stop it. It has to spread. It will spread in all directions. And let the people will understand the panchakarma. And while the similar type of articles are given by the leading the counterparts, we need to ask them, do you have a data to say that it is going to damage kidneys, it is going to damage the GI tract, it is going to damage the things? So we need to ask them. Without data, how you say that? So then it is only a fear or only speculations. So you have started writing your articles based on the speculations. So we need to humiliate them in public in such manner. Then automatically things will settle down.
A participant has written, at least those who recover from diseases successfully, the success itself will make other people to start believing it. So it increases the responsibility of all Ayurveda stakeholders, like all of us, to do more in our fields and bring success and heal more patients. So.
Definitely, definitely. The ultimate aim of our practice is just to bring the solace to the people, and as far as possible, try to bring out the good thing out of it. And if they are having some trouble, let us try to heal it up. So that is the only way we can bring a good name as well as fame, and you can even show to the world that these are the data which is generated, and these are the things which can be possible by Ayurveda. And we have such so many success stories in a sporadic manner. It is available all over. Every Ayurveda doctor, pure Ayurveda practitioner will have some or the other cases which is very much successfully handled, and before treatment and after treatment, such type of things will be there, very common. for example, even mucormycosis, when a new thing has come, Dr. Rajnikant Patel has achieved so much of success in that. Similarly, there are so many people that can bring out the things, and they're already doing their things. And those only green about this is that when they could not do achieve it, and somebody is doing it, they started feeling jealousy. So then they start telling that no, this will going to alter Ayurveda, this is going to disturb the pure Shuddhata, and all these things are nothing to worry about these things. These things will not going to help us in any way. We need to allow it to grow, let it grow. Whenever it is required, classically, we need to mend it. That type of mending should be done, and that should be done with a forum of doctors, Ayurveda doctors, with a classical background, with some sufficient evidence and documentation. So then that will be fine to rebrush it and make modifications as per the requirement of the day.
Yes, sir. And moving on to next topic, research-related news has attracted a lot of attention. This one is on Rishyagandha. It says new variety of Rishyagandha which can cure all types of cancer developed. So Banaras Hindu University, one of the leading Ayurveda universities of India, scientists have developed a new variety of medicine plant Rishyagandha, which has the properties to treat all types of cancers, especially cervical cancer. After 8 years of long research, the new variety was developed using nanobiotechnology. The research done on the basis of Indian Ayurveda is now being approved by scientists of many countries. I think they're using one thing called as Withania coagulans, and they're using it. Can you please shed more information regarding this, sir?
See, it will be very premature to say that just because of 8 years of research, they could able to bring out one plant due to nanobiotechnology. But claiming that it is going to cure all cancers, it becomes premature. Maybe that is true, but we need to be very cautious in claiming. So one thing, then this is Britannia coagulants. What they are telling is it's already in the market and people are using it for making paneer. It's a very for making cheese and these things. It has been used since so many years. Paneer doda, it is available in everywhere in northern India. If you just go observe it, it is available in the form of a powder and it is being sprinkled on the milk. It becomes a very beautifully covered curd will be ready. A good quality curd, paneer doda or paneer. It's very commonly available. This is Withania coagulans, flowers. It is even previously it has been largely promoted for the purpose of anti-diabetic action. People are saying that it is going to help in diabetes in a very great manner. Those people are using it like this because it has a coagulation capacity. So I don't know in what way it is going to help, but people are using it. But now they are telling that it is a new nanobiotechnology and they have developed a new variety genetically, something like that in the labs. So we need to be very cautious in claiming it be, but we need to have at least some smiling on our face that Withania coagulans, which is known to us already and which is now one of the potential drug for the cancer cure. Then that is the good part of it.
That dilutes the scientific language of it. Rishigandha is mentioned in Charaka's Brahmaniya Gana, sir. Are there any herbs identified with that name, sir?
Actually, there is no, as such, the popularity are mentioned about Rishyagandha in that sense, but it is belongs to Ashwagandha family, and at times like that, Ashwagandha looks like Ashwagandha, so that's the reason they are kept as a Rishyagandha. But it is popularly known as Paneer Dodar, Paneer Kiful. That is the one which is extensively used rather than the medicinal use. And recent days, it is being used for the diabetes. That is one of its important medicinal use.
Thank you, sir. And moving on to the herb of the day is aloe vera. Aloe vera chinensis or aloe verbedensis. Guru, sir, can you please go through this herb, very important herb of Ayurveda, very famous as well?
It's a very important herb or a very famous herb of Ayurveda, but fortunately, we don't find a mention of this drug Kumari in Charaka Samhita or Shishu Samhita anywhere. This drug has been introduced to Ayurveda in this Nigantu Kala, 8th century onwards. So, but this is one of the wonder drug which has been extensively used for various reasons, and it is one of the important Tiktarasa Dravya and it is a very good colon cleanser, and it is good to hair. It is good in the conditions like any dandruff or flaky, itchy conditions, and it is very good in allergic, blood-related or skin-related allergy conditions that it is used, and it is extensively used in menstrual disorders. Kumari as well, we are a very popular formulation, and also we have even it is in Rajapravartinivati, and so many things it has been there. But this is one of the wonder drug which is extensively used with a cosmetic value, as well as it's a good effect on liver. So if it is taken in large doses, it causes virechana, and it is anulomaka in nature. And of course, it maintains the hydration of the skin when it is applied locally. And if it is put into hair oil or in the hair, then it is going to definitely support us in a very beautiful manner. It's good for hair, it is good for skin, and it is good for liver. It is used for jwara. So many things are there with this.
What's its role on blood, sir? I mean, yeah, I mean, like you told in Rajapravartini, it is used. Rajapravartini, what is used usually in case of like amenorrhea, where periods are not happening on time. At the same time, it is also indicated in like Rakta Pitta Hara. I think Baba Prakash has mentioned that. How it affects the blood tissue, sir?
No, it is not for the blood tissues because it's basically one of the drug which has an effect on liver. We know that liver and spleen are considered as a Raktava Sroto Mula. So from where the manifestation or the manufacturing of these blood particles will take place. Multifaceted action. Its effect seen on the endocrine system as well as in the uterine system. And in the uterine system, its effect is seen as an ecbolic. It causes the contractions and brings in the menstruation. So it try to remove the content from the uterus. In that way, it is used. It is not going to affect any blood anywhere in that. But otherwise, it is good for the production of the blood because it is having a detoxifying effect on liver and spleen. And these two are the mula of Raktavasrotas as per Ayurveda, and definitely they are going to help in that direction.
And aloe vera juice has become like very famous along with like gilo juice, gilo ras, aloe vera ras, and like everybody takes it. Especially in the North India, I've seen many people take it even without consulting. Just bring gilo juice and aloe vera juice, and they start adding water and taking it because of advertisement and spiritual gurus talking more and more about it and whatnot. Do you recommend it on a daily basis for healthy people as well, or?
No, we anything on a daily basis it should not be done. We need to check it out whether it falls in the category of swasthahita dravya. Swasthahita dravyas are only indicated on daily basis. All other things are if required and seasonal. Based on the requirement and season, one has to do it. And of course, in a less quantity, it is particularly aloe vera is used in northern India in a place where it is constipation is very rampant. So, in order to overcome the bowel cleansing activity or the constipation thing, the people use it. Even Kumari and young leaves are used for preparing sabjis. So it is not just simply only the juice is used. Even without that, things are also used. And it is one of the important liver rectifier. So definitely it is going to useful in improving the Pachaka Agni. So definitely Agni is going to improve with this. So that's why, and even it is Anulomana, it clears the bowels and it removes the pitta from the bowel. So definitely it will going to help in that sense, improving the digestion and metabolism.
Being Tirtharasa and having this mild anulomana action, probably it's one of the good herbs to consider for bloating, sir.
Definitely, it clears the bowels and as well even it clears the gases, bowel gases, and also it improves the bile flow, and it also improves the activity of Apanavata. So it's one of the wonder drug, and it has a multifaceted actions.
And it is named Kumari. Kumari means like probably small girls or teenage girls in Sanskrit, because it it addresses most of the complaints of teenage girls like irregular menstruation or hormonal balance, digestive issues, and also skin acne. So,
Yes, definitely. It improves vision. It is good for the hair. It is good for the scalp. It is good for the dandruff condition, hair fall, and so many conditions related with that. And of course, with the menstruation irregularity. So, in all these conditions, it is addresses it. That's the reason probably Acharyas, I mean, people have kept the name as Kumari. Or Grita Kumari also it said because of its content is something like in the ghee format or something like that, or consistency. So based on that, there's a reason they have said Grita Kumari.
and it is used as vegetable in some places like sabji is prepared. Okay, I mean with cooking is fine. Like can a few pieces of it be eaten raw?
It can be eaten, but it is very thick. Those who can withstand that thick taste of bitter principles, they can take it. Because the central jelly portion in a leaf, Kumari, doesn't have any much taste. It is somewhat softer. But we need to have that outer thicker cuticle, whatever it is there in the leaf. That portion yields a yellow color coumarin. That phytocumarins are there present in that, and they are going to cause even purgation if it is taken more.
It is also like frequently used in Agnikarma where they will just, especially in sciatic and all, I have seen they just do the Agnikarma with a cautery and then soon after it is applied. Probably a good contender for like in treating burns, wounds, etc. So,
Definitely, it is very good on skin. That's the reason when we go for Agnikarma and even diabetic foot ulcers, many a times we use haldi, that is turmeric, in the along with that some kshara like yavakshara, little bit yavakshara and turmeric is mixed and made as a powder, and this powder is sprinkled over the half cut leaf of the kumari, and it is applied to the wounds. It also has a very wonderful wound healing activity. So that is the reason it is very good to skin. So wherever the skin is needs to maintain the hydration, there we can use it. Where there is a separation of skin layers are taking place, where it can be used because it try to maintain the bonding between these layers and cells. So similarly, where there is a tissue damage and wounds and pranaropana karma and all these things are very effectively done. Hence, even that area it has been extensively used. Even
and
that Kumari used in many of the ointments in the market available for the purpose of scars removal. There are plenty of scar removal creams are there which do contain Kumari in that because it is very good on the skin and maintains the originality of the skin.
I just was surfing and we have like a Patanjali Pachak Ajwain powder with aloe vera. So definitely used in bloating and other things are there. Like, do you have any like for acne and all? Can it be used raw directly on the skin, or do you have any remedy for this?
Cut surface of aloe vera can be rubbed on the pimples, but definitely it's a content, particularly that bitter coumarin, it comes as a yellow secretion. It penetrates, it is having a capacity to penetrate even through the skin. If it is applied more, then also it may have a chance of causing purgation. So we need to take care on that part, and you can use it, no issues.
There's a question: 100% natural, sold in a tube. Is that safe to take also, or it should be only the fresh one to be taken?
That is based on the availability. If you have a belief on the person one who is selling it is fresh and safe and it is sterile, if it is agreed to you, you can take it. Or otherwise, you have an opportunity of using them in the natural because you have grown yourself. That is good.
But once a gel is taken, it would not. Gel is taken out, and if it is canned or if it is tubed, it will not survive for long without using of some kind of preservative. So,
Definitely, but sometimes when they are being packed, while packing, they make some sort of vacuum creation and make it tight and avoid the oxidation and all these processes. That's why it retains for certain times. But still, it is having a very short shelf life in that condition also.
It is told that Gulmahara, Plihahara, and Yakrit Vriddhihara in the Nigantus. I got this reference. So, what is in which liver condition can it be used, sir?
Any hepatitis or even hepatomegaly, those conditions we can use it because it improves the bile flow out of the liver. So it improves the bile flow from the liver. Automatically, it improves the content are squeezed out, and automatically the swelling will come down. That's the reason the hepatomegaly and hepatitis condition type that all inflammatory changes that will be go down with the use of Kumari.
Moving on, there's a gel and juice available for internal use. Is one considered to be better than the other, or also what about its usage in gastritis and heartburn?
See, purely gel is good for gastritis because it helps in coating. But if you want to have in the name of Kumari, if you are consuming or aloe vera, if you are consuming with an intention that all its activities are kept in mind, then it is better to go with the juice of that because juice is entire leaf is squeezed or crushed and it is juice is taken out and which also has some part of coumarin and all those contents. Otherwise, pure gel doesn't have that coumarin part of it, and it may be just a soothing effect, or it may be just coating the abdomen and the gastric layers. So it may be good for the gastritis, but may not show any action on liver.
Is Kumari juice or Kumari asava is a good anupana for many pitta dominant disorders because it is mentioned in Rakta Pitta Hara as well.
See, definitely it is good, but it is in the form of what formulation you are giving. It's very important. If you are giving in the form of a gel or a juice, it's okay. But if you are giving in the form of a asava, then dosage part has to be needs to be understood because dosage if you increase, then also there is a chance of that gastritis may increase rather than reducing. And moreover, we need to understand certain things. We are very much dependent on the manufacturers who manufacture it in a large scale. We have seen people using self-generated alcohol should be there in that asava aristas, but sometimes people are adding because of the market demand, adding the ethyl alcohol directly in that proportion in a dilution and such type of things are there, then it is rather than helping, it causes further more damage and burning sensation and even increases the pitta. So that is there. We need to be very careful in that part of it. So in that sense, if it is better, we take juice of it as it is raw. If you are able to get it and make a juice out of it by personally, then use it. Then you have a better results.
And it is also one of the beloved herb in the field of Rashastra. It's used in Basmikarana of Tamra and Pravala, Shankabhasma, even in Kapardika Bhasma, etc. Especially it's because it's used in Pravala, Shankabhasma, Kapardika Bhasma, again, it's imparting its role in like digestion and bloating, etc. Sir, because they are also used there.
See, in Russia, Astra, we need to understand these. They are made as a herbo mineral many a time. The main activity of these herbo mineral drugs is that they are carrying the herbal drug activity very rapidly to the minute levels because of their sukshmata. They are the nanomedicines and nanoparticles. See, these nanoparticles being triturated or treated with these herbal contents and they imbibe the herbal content activities and carry those herbal content activities to the minutest part of the body. That's the reason they are used it. And of course, Kumari is one of the versatile drug and it is been mentioned by our acharyas in many Pitahara Dravyas wherever it is to be prepared or even for many times Shodhana purposes it is being used.
Yes, and there's a question on Kumaryasava being used in hepatic disorders. Kumaryasava is used extensively as Vrishya, Rochana, Brahmana, improves digestion strength, acts as an aphrodisiac, used in Udara Roga, Meha, Apasmara, Mutrakrisa, and there are also like Kumaryasava number 1, number 2, many varieties are also there. Sir.
See, Kumari Asava, number 1, number 2, number 3, all these things are there. They are peculiarly used in the purpureal conditions. After the delivery, first month, second month, third month, they are be using it and they have created these things. Even in market, we get Badantakada 1, Badantakada 2, something like that, which is also similar to this. And otherwise, general Kumari asava, that is one of the important drug which can be used in amenorrhea, which can be used in after delivery, postpartum, and delivery conditions, as well as it is used in liver disorders, even hepatitis, even ascites conditions. We can use it.
Going ahead into your case study regarding hair loss treatment, we have already had many of the case studies from you. Can you please explain this case, sir? Because hair loss and its hair rejuvenation is always an evergreen topic.
See, this is a young person, 28, 29 years old. He came to me with this saying that, is it possible to have a natural hair? Then I just understood his history, and he has some sort of increased testosterone activity is there, and even family history is also supporting it a little bit. So then I said, okay, we will try with these things, and you need to cut down on certain activities. So one of the important activities you need to cut down is you should sleep by 10:30 in the night. You should not be awakened for a long hours. Avoid watching TV and these LED display units for a longer hours. And and I have given him Narasimha Rasayana as a rejuvenative and post immunity improvement thing, which is also used in many times for the purpose of increasing the hair growth. So with these medications, when I started with that and some restrictions on his diet as well as his lifestyle, the result has started to showing. Within 2 months, it's quite good, and patient is feeling happy with that and is continuing the treatment now.
Yeah, and you also shared another image of another treatment. This is after 6 months. Pardon me, but I think you shared this as medicines used there, sir. In this
Definitely.
case.
See, in this case, this is another case. He is having even issues with his fertility. He is married and still infertile, and he has got something related with that. And when he came, it was a total alopecia type of material on his scalp. The scalp is shiny, all those areas where the hair is not there. I could not even see the follicles over there. Then I suggested that once again, same pattern of restriction on diet and the way of life, and continuously applying that hair oil and consuming these Narasimha Grita, Trichip capsule, and something like that. And of course, on different occasions, I use Kuntala Vardhini Taila and Malatyadi Keram on alternate days in these fellow. And once in a while, that anagen growth would be rubbed to the places where there is no hair. And Narasimha Rasayana and Trichup as a supportive, continuously we are using it.
How would you assess if the testosterone is not, if it is increased testosterone, how would you address with Ayurvedic medicines, sir?
Now, if it is increased or decreased, I have because the patient is worried about his hair first. Then, after getting these results after 6 months, now he is considering that he went to even to take medicines for his infertility. Then I suggested him that you go and test all these things, but he need to yet to come back with the reports. He has not come out with the reports yet.
Yeah, and like Kuntala Vardhini, I know that you have shared that it's your own formula. You have been generous enough to share the formula also in one of the previous episodes. But why don't you like get it manufactured in Pentacare and so that we can all use and it becomes like widely famous.
No, we will see that because what I am using in the typical format, see when first Bringaraja and Tulasi, Kaidariya, Amalaki, tea powder, all these been Yastimadu, all these been put into that, and it is boiled and Kashaya is prepared. After Kashaya is prepared, next when it is once again boiled, at that time I will use raw tender coconut in the form of chutney. I mean coconut chutney. Then along with that I use Kumari, fresh Kumari in the form of crushed kalka. I add it to that. At the second level when oil is added. So that needs to be done in that fashion only. Then only that peculiar color and consistency it comes. And of course, I'm doing it since last 7 years now, 7, 8 years personally. Almost every month, around 50 to 60 bottles I prepare, only that much, and I sell it to my patients. I don't go for any marketing and even for this. Anybody can prepare these things. I have already shared the formula of that. There's no hide and seek in that.
And what's your idea of including tulsi in this, sir?
Tulsi is one of the antiviral and as well as bacterial. It avoids in scalp itching. For that purpose, Skydaria and as well Tulsi both will help in scalp itching. And scaly things to be avoided. For that purpose, I have used Kumari and Estimadu.
Okay, and moving on to like this tube, it's one of the like consistent performer herbs of I mean medicines of Ayurveda, isn't it, sir? It's there since more than 2 decades and a very good one, sir.
It is one of the good drug. You just observe there, in what I have said in the Kuntala Vardhini Taila, Bringaraja is there, Brahmi is there, Estimadu is there, Japa Kusuma is there, Tilataila is there, Narikela is there, Amalaki is there. Only three things, Nimba, Neeli and Musta are different here. In those places, I use Tulasi and I use Kumari and I use tea powder. These are the three extra ingredients which I use. So yeah, and even oil in a 75% and 25% ratio, that is 3:1, coconut versus tilataila or gingerly oil. And one of the important thing which I used to say, I mean, in this point of time is people, those who make these type of oils, and they'll feel, and many times when they think of commercial things, they'll somehow they'll try to have a more profit. But I am not here for the profit, so I use the Tilataila and Narikela Taila. Both are of edible grade. People say that many a times simply Deepam Taila or something like that, oil which is taken for candles, and even for that purpose they are used. And that oil is used for making the Ayurvedic hair oil. Anyway, it is going to be applied on the outside the body. It is not to be taken in. Then what is the no? That is not the criteria. I use the one which is we eat the same thing, Tilataila and Narikela Taila of edible grade, which can be taken in. The same oil is to be used for the production of hair oil also. Then only we'll have a, if you don't compromise on these type of issues, definitely the results will be there.
This also has Chichu capsule also has like Saptamrita Loha and Mukta Shakti Bhasma. Do you see a correlation between hair loss and lack of iron or calcium?
Definitely, definitely. We have a lot of issues that iron will be at stake and in calcium at stake. See, many a times it is either hormonal or it may be deficient state, which is are the post diseases. There will be hair loss. Sometimes it will be supporting by the family or the hereditary factors. Otherwise, most of the time it is by different type of situations where deficiency of iron, deficiency of calcium, and deficiency of folic acid, and these type of things will also end up in hair loss. Then there is a post disease like typhoid fever or malarial fever or something like that. Then afterward, then that they particularly 40 years around age factor. Then comes the hereditary support. These are the usually 4 or 5 varieties of patient we used to come across, and very rarely some rare occasions some very premature hair loss people will come. Otherwise, these are the main area where we have got a lot of people come with these type of things, and we try to convince them with the use of medication as well as applying oil, because many of the young generation doesn't want to apply oil to the hair, and if you don't apply oil to the hair, then the hair will not be present. If you want to keep your hairs, you apply oil. The very straight way I will convince them.
Yeah, and Saptamrita also plays some role in hair loss. Definitely, Trifla is there, and Yastimadu, and with Loha. And doesn't Narasimha Rasayana increase weight? Can this be given in some people who are already obese and battling for weight loss? A few teens, male here in US, are experiencing hair loss. because of excessive testosterone levels. Any other lifestyle suggestions other than good sleep and any other hormonal tests like thyroid, etc., that you recommend?
Yes, of course. Many a times thyroid also plays a role that needs to be checked in. And of course, while taking history, we'll come to know about all these things. When we ask them, do you suffer from any conditions? Do you taking any medicines for any conditions for a long time? Or are you suffering from diabetes, hypertension, hypothyroidism? No, it is a very common protocol. We'll ask each and every patient when they come. So when such information is available, then definitely we'll try to assess those hormonal levels also before they starting the treatment. And definitely those who are obese, we cannot give Narasimha Rasayana because of course it helps in gaining the weight. But what I suggest is when we are having this type of trouble, we are unable to give Narasimha Rasayana, then we have one or two companies producing the same Narasimha Rasayana in the form of Narasimha tablets. So where there is no butter and ghee portion of this, only the drugs are available in the form. But still, we can't expect the result would be the equal. But something it's a better alternative for that.
I see Sitaram Ayurveda has Narasimham tablets.
Yes, yes.
And last question for today is: does Nasi also help in hair loss treatment like Brahmi Thaila?
Definitely, but for Nasya it's very difficult because the one which is suggested is Nasya with Nimbataila. If Nimbataila Nasya, if it is done, it causes a lot of irritation. It is not so easy to withstand it. But those who are having Sukumarata, please avoid it. It is not possible for them to go through your treatment of Nasya with Nimbataila, or simply you can go with Anutaila Nasya or something like that. You cannot go for that. But the one which is recommended strongly for hair growth is Nimbataila Nasya.
So probably this hair loss is somewhere related with some virus or some microbe for sure. So because I mean Tulsi, like you told, it has anti-potent, antimicrobial activity, and Nimathaila Nasa is also told. And there is a concept in like modern that probably all diseases are related to one or the other microbes. Just we need to come to the bottom of it. Like H. pylori, I mean gastritis related to the H. pylori, gastric ulcers, which was discovered very late. Probably Krimichikisa should be part of most of Ayurveda treatments, sir.
No, we need to cross-check or we need to rethink about the Krimi Chikitsa of Ayurveda which is told, which probably may have a very strong effect. And even I'm worried and wondered, is it possible to validate Acharya Shushruta's statement in Rasayana Adhyaya? Acharya Shushruta says, Vidanga Rasayana, wherein continuously that process has to be done and Vidanga Rasayana is given. Person is to be made to immerse in a droni containing oil and all those. I don't know how far we need to immerse their body or up to the neck. We don't know that class. I mean, that information is not available. But what the benefit of it says that the person will lose all his skin and hair, then slowly new skin and hair will come out, which is very beautiful. So we need to re-understand it or try to understand and evaluate what exactly it is and how it should be done.
Nowadays, this Kuti Pravashika Rasayana has been like revived, and many people follow that, like as per told Ayurveda. Probably, that will also be tested very soon. Anyway, just like bright days ahead for Ayurveda and all of us. So.
Definitely, they see people will go to the one shop which comes in the first. When they taste and enjoyed it and their routine and becomes, then they want something different. When they come to Ayurveda, then they relish it, then automatically they start telling good about it, and slowly the market will expand. And it is a ever-growing area, and we are already seeing that there is a lot of push is also given by government and even the central government and state government. Definitely, and its growth is also increased all over the world. And of course, just like yoga, this is also picking up in a very right sense under the present regime. And we should be thankful to the approaches the people are doing it. And of course, we need to stick on to the basics of Ayurveda to carry on this legacy to the next generation.
With that positive note, I thank all the participants for their active participation. And on behalf of all of us students, big thank you for Guru sir.
Thank you all for your patient listening. Thank you, Janardhan.